If you have ever been to an OPD, you know this feeling. You arrive thinking I'll be done in 20 minutes and suddenly it's been 2 hours. People get frustrated, some get angry, some give up and leave. But here is the truth. OPD waiting time is not just about a slow doctor. It is a system problem. Today I'm going to explain the real reasons why OPD waiting time becomes so long in a simple way. And also I'll tell you what you can do to save time and avoid stress. When people say I waited for 3 hours, they usually mean more than just waiting for the doctor. In real life, OPD waiting time includes waiting to register, waiting for the doctor, waiting for tests, waiting for reports, and sometimes even waiting at the pharmacy. So even if the doctor is fast, the total time can still become very long. And studies have shown that longer waiting times are linked to lower patient satisfaction and more discomfort during the hospital visit. Now think of OPD like traffic. Even if your car is fast, you can't move if the road is jammed. In the same way, even if a doctor is experienced and quick, the doctor cannot move faster than the hospital system allows. OPD becomes slow because too many people enter the system at the same time, and the system has limited capacity. That's why waiting happens. Now let's break it down step by step. Reason number 1 is the most obvious. Too many patients, too few service slots. OPD is the first stop for most people, and many patients choose public hospitals because they are more affordable. So on busy days, the patient load becomes higher than what the hospital can handle smoothly. Research on outpatient waiting times shows that one major reason for long waiting is patient demand exceeding service capacity, which means more people are coming in than the hospital can serve on time. When that happens, queues don't move, they grow. Reason number 2 is something most people don't notice. OPD is not one service. OPD is many services connected together. Your journey usually looks like this: registration, waiting, doctor consultation, tests, reports, review, and then pharmacy. But every step takes time, and even if one step is fast, another step can become a bottleneck. Research shows waiting time is affected by the entire workflow, especially administrative steps like registration and billing. So the delay is not always in the doctor's room. Sometimes the delay starts before you even meet the doctor. Reason number 3 is very important. Not every patient takes the same time. Some patients need 2 minutes, some need 15 minutes. One person may have a simple cough, another person may have diabetes, BP, weakness, and past reports. A doctor cannot treat every case like a checklist because the doctor has to listen, examine, think, and decide. So even if the doctor is working non-stop, the time per patient changes. That's why the line moves unevenly, sometimes fast, sometimes slow. Reason number 4 is something many people don't like, but it exists for safety. Serious cases get priority. In hospitals, patients are often seen based on clinical urgency, not only by arrival time. If someone comes with severe breathing trouble, chest pain, or fainting, they may be taken first, even if others were waiting longer. This is part of how triage and emergency prioritization works. So yes, it can increase your waiting time, but it also saves lives. Because in healthcare, the goal is not first come, first serve. The goal is most serious first. Reason number 5 is the system itself. Waiting time is influenced by staffing levels, scheduling systems, how departments coordinate, and how smooth the hospital process is. Many hospitals still depend on manual steps like paper files, manual entries, and crowded counters. That slows down the flow. Research also shows that improvements like better scheduling and electronic systems can reduce waiting times when implemented properly. So the issue is not always effort. Sometimes the issue is infrastructure and process. Now let's talk about the real impact. Long waiting time is not just a wasted time. It can cause stress, anger, fatigue, missed follow-up, and sometimes delayed treatment. And research evidence shows that shorter waiting times are strongly linked with higher patient satisfaction, which means even if treatment is good, a painful waiting experience can still make the hospital feel bad to the patient. So waiting time is not just a small issue, it changes the whole experience. Now here is the most valuable part of this episode. You may not control the hospital system, but you can control how prepared you are. These simple steps can save your time and make your OPD visit smoother. Step 1. Go early. Try to reach in the first 1 or 2 hours after OPD opens. The later you go, the more the queue builds. Step 2. Carry one clean file. Keep all old reports, prescriptions, and important documents in one folder. When you are organized, the doctor understands faster. Step 3. Write your symptoms in your phone. Before you enter, write when it started, how bad it is, what medicine you took, and what changed. This saves time and prevents confusion. Step 4. Ask only 3 clear questions. 1. What is the diagnosis and possible cause? 2. What should I do now and for how many days? 3. When should I come back and what warning signs should I watch? Step 5. Respect emergency priority. If serious cases are taken first, it can delay you, but that system exists for safety. Prepared patients get faster and better care, not because they're special, but because they make the process easier. So today you have learned the real reasons OPD waiting times becomes long. 1. Too many patients and the limited capacity. 2. Multiple steps in the workflow. 3. Every patient needs different time. 4. Emergency priority interrupts routine flow. 5. Administrative and system delays. This is the reality inside Indian hospitals. In the next episode, we will uncover another big question. Why do hospitals ask for deposits before treatment? And how does billing really work? If you want episode 2, comment episode 2 below. And if this video helped you understand the system better, subscribe for the next episode.